Absolutely. We've actually got a question. So Melanie, thanks for sending that question through. So the question is, how long does the ultrasound tightening method last?
Yep.
I'm only 45. Would that be a safe way to start, that maybe move on to a surgical procedure possibly later? So that's a really good question,
Fantastic
Melanie.
question.
Yeah. So look, as we age, we're losing that collagen and elastin, and what the Ultraformer does is actually stimulates and boosts strengthening and tightening, and stimulates new formation of collagen in that area. So the more we can do non-surgically, preventatively, yes, it does help to delay those procedures, but it's all about what patients' necks look like. So if somebody's got quite a moderate amount of laxity to start off with, they may have to do a combination of procedures, but Ultraformer is definitely a good one to start off with the neck. So yeah, I definitely recommend
It's a fantastic treatment, and in fact, it's a minor form of trauma, isn't it? It's a sub. Yes. It's not a serious trauma, but it's a minor form of trauma for those deep tissues. And the way I think about it, and correct me if I'm wrong, is as we get older, our regenerative capacity of the cells in every tissue level and in every tissue plane becomes a little lazy.
Yeah.
And in fact, this minor trauma just wakes it up. It just says, come on, you remember what to do.
Yeah.
You can make a bit more collagen. Let's just sharpen up those elastin fibers. Let's pull again, and let's rejuvenate the area.
I completely agree. And the beauty with the Ultraformer is that you can actually address different depths within the skin. So yeah, really, really good for that bulk collagen stimulation to the area. Yeah.
Love it.
So Melanie, we can give you some details. We'll send you a message after, and let us know if you'd like to come in for a complimentary consultation.
Fantastic.
Hope that's answered the question.
What about tummies?
Tummies. So again, how do I lift? How do I tighten? Something that lots of patients like to ask.
Yep.
I'm a mum of 2. I've had 2 children, put lots of weight on with both pregnancies, so did get quite a bit of laxity afterwards. So something that I was really looking for as well. So my favourite thing again is the Ultraformer. So the Ultraformer again is really good for that deeper tissue tightening in the area there. So yeah, that's my favourite for that. And again with the tummy area, we've also got to do the total body assessment. What's causing the issues in the area? Is it looseness in the skin? Is there muscular changes? So separation post pregnancy? Is there excess fat in the area? So again, we've got to look at different components of it, and if it's the right thing to do on its own, or if we need to do a number of things.
I mean, speaking personally, I often see all 3 things in combination: an excess of skin, an excess of the fatty layer under the skin, and the muscles that have separated. And we're talking about the rectus abdominis muscles, or the washboard tummy muscles that very fit people have, like Lisa, and they pull apart as you put on weight, as you get older, and also having babies. So in bringing them back together, it does help with the core strength, it does help with your core integrity, and it also helps with the contour of your waistline. Very seldom do you find, at least in my experience, that it's just an excess of skin, or it's just the muscles that have separated and everything else is running fine and tight and smooth. So for me, it's working out what contribution each of these areas is making to the overall deflated look of that tummy, and how best to tighten. And if we can get in early and use things, non-invasive techniques like the Ultraformer, that can re-establish a lovely tone to the abdominal skin, which is the outer layer of the band that forms the abdomen. And it also, if it's repeated on a semi-regular basis, 6 to 12 monthly, it just maintains that tone. It keeps those little cells awake, and you maintain that shape. But when we're a little bit beyond that, then we have to think about more invasive techniques. And in terms of tummy tucks and liposuction, tummy tucks can be done, we call them a mini tummy tuck, where it's really just the central lower portion of fat and skin that's removed, and the belly button stays where it was. Or we do a tummy tuck where the belly button is repositioned, so more skin and fat is removed from the abdomen, and the belly button is repositioned in the abdominal wall. And then liposuction, often done in combination with both of those, or as a standalone procedure. And that just allows us to selectively deflate that fatty layer that exists between the skin on the outside and the muscle underneath. In deflating that, if you've got good skin tone, fantastic. The skin will tighten up all by itself, or with the help of Ultraformer treatment. But if the skin doesn't have that elasticity still, and all you've done is deflated the fat between the muscle and the skin gets really loose and floppy afterwards. And that's not a good look.
No, it's good to do everything in combination.
So tailor the technique, choose the appropriate option, and timing. 3 T's.
I think we've covered it all.
I think we've covered it all. If anyone had any other questions, it'd be lovely to hear from you now. Otherwise, we can attend to them later on if they come through subsequent to tonight's presentation.
Yeah.
We should do this again on each of those areas, I think, in more depth. There's so much to talk about.
I think that would be really good.
Right, well, from James Southwell Keeley.
And Lisa.
Lovely to see you all, and we look forward to our next discussion together. Lara Health and Beauty with a big blue building on Edgecliff Road, down the hill from Bondi Junction.
Fantastic. We'll see you all again.
Ta-da.
Bye.